And we're ready for PowerPoint. Let me share my screen. And beginning. Can everyone see that okay?
Yes.
Awesome, awesome. So thank you for having us. A wonderful introduction. I appreciate that. Happy to be here. And what we wanted to basically go through is a little bit of an overview of what lifestyle medicine is and how that factors into the kind of care that we provide, and then how that applies to a diagnosis of cancer. On the side of the screen here, just as a reminder, we're both with the UPMC St. Margaret Family Medicine Residency Program. I am a resident. And then I also have the banner for the American College of Lifestyle Medicine, which is the basis of lifestyle medicine and its incorporation into our learning. Go next slide. There we go. So I'm just going to briefly introduce this slide, and Lindsay, if you wanted to just pop in and talk a little bit more about some of those things as well, because I know you do a great job reviewing this. But the lifestyle medicine, the core of it is really these 6 pillars that we try to focus on in our recommendations. And I'll have Lindsay hop over and if you want to say anything a little bit more with those.
Sure. So just to give you all also context, because it's a little confusing when we talk about like being lifestyle medicine doctors. So I'm board certified in family medicine. That's my specialty. And Nick is in his training right now and will be board certified in 2.5 years or so. So we're family medicine doctors. And then there's additional board certification, additional training that you can do in lifestyle medicine. So I've already completed that. And then Nick is in the process of doing it now. So the thing that I love about lifestyle medicine is that it's all evidence-based. So other types of medicine are lovely and wonderful, things like integrative medicine, complementary medicine. But one of the big differences with lifestyle medicine is that everything comes back to these 6 pillars and it's all evidence-based. So the only things that we're going to share are things that we've shown through studies work, or we have good evidence that there are things that will benefit people. So it's less, I guess, woohoo, as some people might say for some other things, and more really grounded in that evidence. So the 6 pillars are being physically active. So this doesn't mean running a triathlon. This means, like Jen was saying, like taking that 10-minute walk before she goes into the hospital kind of thing. So being physically active. Managing stress in whatever way that works for you. So for some people that's yoga, for some people that's deep breathing, for some people that's spending time with a loved one and it just kind of lowers those cortisol levels. Forming and maintaining really good relationships. And there's pretty good evidence for cancer where that's really important to have those support systems and people around you, family, friends, groups like Happy Feet. Having restful, good quality sleep. So not just like I'm in the bed and I'm laying there for 10 hours, but I'm falling asleep quickly, I'm staying asleep, I feel really good when I wake up. And then reduction of risky substances, so mainly tobacco, but also alcohol and any drugs that might be harmful to your organs. And the last thing that we'll spend a little bit more on time on today is that healthful eating. And the main goal that we try to help people work towards is the whole food, plant-based eating. So that doesn't mean that by the end of this, we're telling everyone to be a vegan. Like that's a pretty overwhelming thing. This is more of a shift to be eating more foods that if you were to hold them out, your great-great-great-grandmother would know what that was. Like a box of Velveeta, they may not know what that is, but an eggplant, they're gonna be like, oh, that's an eggplant. So we want you to help think about ways to get those whole food things from the earth right to your table rather than through the whole processing that happens with a lot of our food.
Thank you. Yes. So these are the 6 pillars, and I think we're going to roll right into the diet, which will be the first one, which is a really comprehensive pillar of lifestyle medicine, where there's a lot of evidence and a lot more of a push now to approach like food as a medicine in a way. So there are some associations that we've been able to identify in the past, and I put this slide here partially to discuss some of these, but also as that bit of a reminder that there is an implication in what we eat and what we are putting into our bodies and doing to our bodies that can either increase risk of certain types of cancer, or that there is, still ongoing research in this department as well. So colon cancer is quite a prevalent cancer, especially in America. There are some studies, recommending turmeric, which is a spice that could possibly be beneficial in reducing cancer rates. One of our references at the end does a nice job of discussing that. There's also been talk and differing evidence about whether or not red meat is associated with colon cancer as well. And if that has anything to do with perhaps like slow movement through the gastrointestinal tract, or whether it's the iron itself in the red meat that causes what are called free radicals, and those cause damage to the cells in the gut lining. And then also fiber is there. There's pretty well established association that keeping things high fiber and on that, like a plant-based diet might be beneficial in the overall health with or before diagnosis of colon cancer. Breast and prostate cancer are curious in that we see an increase in the association of these for folks, particularly with the Western and American stylized diet. Diets typically characterized and high with like animal fats and an overall low in your plant-based foods that have like a rich in antioxidants. And then a pretty well-known one as well as stomach cancer. So smoked meats and processed meats have an increased risk of developing gastric cancer. So as I said before, some of these things are just kind of, to make note of, but also the fact that there is still that ongoing search for some of these things and whether or not they prevent or help cancer, but that is something that's very much an ongoing thing. So as Lindsay mentioned, diet, the philosophy really is whole food, plant-based diet. I like to think of this as how many, actual foods do you see in front of you like to eat? It's not, it doesn't necessarily have to be, I think in all contexts, like Lindsay said as well, it's not meant to be something of like a vegan. It's just really emphasizing like the wholeness of foods and how more natural some of our choices can be, and kind of catering those to what our own health needs are. Cancer is a disease where your body is in quite an inflammatory state a lot of the time. And some of the recommendations that I've taken from the ACLM and put here in this PowerPoint do focus on that, both for preventative purposes, but then also for how to maintain an appropriate and healthy diet in the setting of a diagnosis of cancer. So the first thing is eating more antioxidant rich foods. Antioxidant foods are really helpful because they can help promote the clearing of harmful substances in our bodies. And you'll see here, it's going to be a trend that a lot of these are whole foods that are fruits, vegetables, nuts, things that are very common and natural. And the list here is pretty comprehensive, but I like to have that almost because it not only just has to be like a one of each, but you can tailor which ones that you prefer, like, or see how many are incorporated in your diet and see where you can either add things or continue things that you really, really like and understand what benefit it has. And then again, I said the inflammatory state, so eating fewer pro-inflammatory foods. You'll see we go to pretty much the other side of the spectrum when it comes to foods that are high for inflammatories, and it comes from a lot of like the bad fats and extra added sugars. So most types of foods that have those to a significant proportion are the ones that we're talking about. So like candy bars and cookies, but also like your Gatorades or juices that have like a high added fruit context as well, or content, excuse me. Preparing foods. So this is something that's shown to be beneficial in preparing. So doing like moist cooking methods, boiling and steaming has been shown and is the recommendation, the ACLM, for preparing like foods as opposed to like dry heat cooking methods, or smoking or grilling foods. And as I mentioned, some like smoking methods, are associated now with specific types of cancer. And then I think fiber is great for everyone, and it's great for a number of reasons, and for a lot of different health reasons and benefits. But fiber here is also important and something to really consider as well, because one, it helps, keep your gastrointestinal tract working appropriately. And that can be a source of a lot of discomfort, especially when there's a lot of medications and things on board, given a certain medical diagnosis. And then secondly, as well, it's also a really great tool to kind of gauge how much of your like whole plants and whatnot that you're eating, because a lot of the best sources of fiber also come from these types of plants and these types of foods.
Nick, can I add a little bit about fiber?
Please.
So fiber is amazing. Fiber just makes your bowels happy. It helps lower your blood pressure. It helps regulate glucose. It can be anti-inflammatory. It's just good stuff. And often you can gauge your health just by how frequent and healthy your poop is. So if your doctor's not asking you about that, you should mention it to them. But the key thing is that dairy and meat don't have any fiber. And so you'll see this common theme where meats tend to be associated with less health benefits than the whole food. The meat and the dairy just don't have any fiber, and they have some of the other carcinogens and things like that. So we love fiber, and we love fruits and veggies. And if anyone wants to talk more about fiber, my email will be throughout this email or throughout this presentation. I'd be happy to talk to you, but there's different types, and there are different ways that we can help you push food out and help you like bring your glucose down or just make you feel better. So love the fiber.
Awesome. Our next pillar is exercise. And a lot of these recommendations were part of the ACLM's, again, essentially slide set regarding cancer diagnosis. However, I feel like they're pretty consistent with what's expected of everyone. And I think that the best thing here is to just emphasize as much activity as tolerated. These are guidelines for general minutes per week. Says to have moderate intensity. I always like to consider exercises once your heart rate starts going, then you're exercising. Try to incorporate as part of your day that can be, or part of every couple of days that can be more specific with just like an exercise. I try not to incorporate too much of like the physical transportation and standing breaks in actual workouts, but I definitely think that these are wonderful recommendations on how to stay more active and get your body moving. I think it's important as well because sitting and stuff can change your body's response to anything. And it can be, in the case of cancer particularly, where we want you to have that baseline that you can have with energy and movement, and then also to be really well set to maintain that through that. So the goal here, is 115 minutes of moderate intensity exercise per week, which I think is in some cases can be quite a lot, but also kind of rethinking what types of exercises you could be doing, whether it's just simple walking, can really add a lot to the add and chip away to that time. Sleep is very important, and I think sleep plays a large part in overall wellness in general, because I think that the trouble happens at the trouble seems to be that it's all only at night, but having sleep issues is really seen as impactful during the day. We recommend, the same as anyone, 7 to 9 hours per night. And making sure that you're getting that restful sleep, that you're able to fall asleep on time, that you want to, and using these other things here is good little tips to help get yourself on a regular rhythm for sleep, because it's establishing that rhythm that's really essential. Screen time is a really big one. And oftentimes folks will do two of the worst things at the same time, which is sitting in bed on a phone. So reserving the bed specifically for sleep and having that avoidance of screen time, I think, is really helpful. And not just removing the screen itself, but also resetting your own mentality as you prepare for sleep. Then always increasing sunlight, and that's great if you want to get out, you want to go for a walk, you get both of those. And then keeping that consistent schedule, as I said, is super important for sleep. And it can really help impact the way that you your emotional wellness, and is something that we really like to focus on.
Can I just add for sleep too, when we're thinking about diet, just going back to that fiber piece, when your diet is higher in fiber, your belly is full longer and you feel satiated and like you're good for the evening. And so it often can help prevent some of that nighttime snacking that a lot of us like to do when we're feeling stressed or we're tired or we're hurting. So really filling your belly throughout the day with those healthy whole foods can help, so that at nighttime you just don't have those cravings, because when you eat some of the sugary and processed things at night, because that's what you're craving, it can affect your sleep. So it kind of all plays together.
Yes, I completely agree. Our next slide here is about stress and stress management, and some of the things that are beneficial in reducing stress. Some of which we've already talked about, which is maintaining that daytime activity, having a baseline for that, promoting good sleep routines as well, getting the appropriate exposure to light that is natural light, being outside, and then also on mindfulness and breathing exercises, which I really think is a difficult task to take on. They recommend here a couple of apps. I've used Calm myself. I think that one's pretty lovely. I also myself use like reading as something that's helpful with stress as well. And I think it all goes to say tailoring those feelings and responding in a way that best suits you is really important. But as I'll go back to the beginning and saying that it's one of the harder things to actually do. Breathing techniques are really cool. In this here, you breathe in for 5 seconds and out for 5 seconds. I also like to recommend that for sleep as well. But I think that those are something that helps to really reset the mind in the moment. And, you know, as managing a medical condition, as challenging as that can be, it seems like stress management could be a very difficult thing to also explore simultaneously, which is why I always like to, you know, recommend just chipping away the best you can, setting some time aside each day for yourself and practicing some of the things that make you feel a little bit better in those moments, so that you can hopefully move forward with the best thing that works for you.
Nick, can I add to that one too? So thinking about bringing it back to nutrition, since that's our big focus today. If anyone hasn't tried, you can search like YouTube, mindful eating. But as you're putting these really yummy foods in front of you that are also fueling your body in a good way, it's a nice thing when you're like, I don't have time to meditate. Most people have time to eat and eat at some point during the day. So during those meal times, you pick one, you turn off your screens, and you're just with your food, and you do an entire experience with that food where you're thinking about the way that it smells, the texture in your mouth, you're feeling it go down your throat as you swallow. And it's a way of meditating as you eat. And it has lots of benefits. It lowers your cortisol, it reduces stress, but it also, food tastes better, and you feel full more appropriately versus when we eat in front of a screen. Often we feel full like 30 minutes later and we realize, oh, I overate. I shouldn't have been watching something. I should have paid attention. So that's another way that you can eat and reduce stress at the same time. Mindful eating, that's what it's called.
And relationships here is a really fun, because I think bonding and having those emotional connections with other folks is incredibly important. And I like to think of this in the context of diet and nutrition as kind of making, you know, your meals, if they can be that kind of like social gathering for your family or friends, cooking together, preparing a meal together, enjoying that meal together. Is something that is, I think, very beneficial in just one, promoting those strong relationships, but also really exploring the fun that can be had in the preparation of your meals and your foods, and maybe even learning new recipes and diets as you go along the way. But I think that this one is certainly an important one in the context of that for folks. Lindsay, did you want to add any for this?
No, I love that you pointed out that time together with meals. I think that's a really, again, everyone eats. So having that space together is a nice way to work that in your day.
And then harmful substances. I think it kind of plays into diet and exercise because a lot of our routine is around some of the things that we are simply just putting in our bodies. And harmful substances is a big pillar for lifestyle medicine and removing some of those things. There's, you know, numerous studies now supporting the use or supporting the association between tobacco and alcohols, but also, you know, with cancer, but also, you know, the benefits here of not using these, or is limiting them, I think also adds for a lot of opportunity in other avenues. I'll go back to like what I was saying in the last slide, like different types of social encounters, different types of, you know, something that you can enjoy with someone together. And always remembering, you know, as much as these are things that we're putting in our body, food is as well. And for alcohol, I know that, you know, there's an association with like all other poor nutritional status regarding that. It has a lot of metabolic derangements associated with it. Your body doesn't necessarily respond the way it used to before alcohol when it comes to things like food. So I always like to keep that in mind as well. Then our next slide here is really, the whole PowerPoint itself was meant to be kind of like an instruction guide for a takeaway. We do have a QR code at the end, but this slide here is essentially an overview of all of, or not all of, but quite a bit of what is available with regards to lifestyle medicine and nutritional resources in the Pittsburgh area. So I was going to tag you in, Lindsay, if you wanted to just talk a little bit about some of these things.
Sure. So Pittsburgh is actually at the front of lifestyle medicine, which is exciting. And by Pittsburgh, I mean sort of the western part of PA. So not just Pittsburgh, if you're not local in Pittsburgh. There are 8 family medicine residencies that are now teaching lifestyle medicine as part of their residency curriculum. And they're doing it in different ways, but that means there are 8 hubs throughout sort of Southwest PA that are really pushing this in their training and making this a priority. Locally, there's St. Margaret, and we have 3 health centers. So there's Bloomfield Garfield, where I'm the interim medical director. There's Lawrenceville, and then New Kensington, where Dr. Dominic is. There's also the Shadyside Family Health Center. And then there are ones throughout. So if you are like, hey, can you help me find a lifestyle medicine doc? You can email me and I can see what I can find near you. I know not everyone's UPMC also. I haven't been able to find a specific Allegheny network person, but there are 2 direct primary care doctors in the area that do lifestyle medicine. And if you don't know what direct primary care is, it's basically, it's a really cool model that you can go see this doctor, you don't go through insurance, you pay like a monthly fee and have whatever access you want with them. So it means you often have longer visits. You sort of have them as a concierge, like when you need them, you use them, and when you don't, you don't. But they're really great, and they often will have different sliding scale depending on someone's financial availability for paying for healthcare. So one is Natalie Gentile, and she has in her health center now like a teaching kitchen, which is super cool to teach patients like as part of the visit, and an exercise area to show different movements. So she's doing some really cool things. And then Dr. Layla Dorderi, who I don't know personally, but I know she's another direct primary care person in lifestyle medicine. So those are just some healthcare providers in the area. If you want to know more, email me. And then a couple of things, if you all are just wanting to get more engaged and like, how do I eat different? How do I shift my diet a little bit? There's something called Plant Pure Nation, which is like a national organization. And within it are these little pods. And so the Plant-Based Pittsburgh is run by a woman, Sally Lipinski. I don't know if she's ever crossed paths with you all, but she's a cancer survivor. And she shifted her diet and was able to sort of take control of her health. And that was, I think, a couple of decades ago. And so she shares her story through food and running this plant-based group. And they do different events, like they're doing, I think, a free mindful eating event, maybe next weekend or the weekend after. She has a newsletter with lots of cool recipes to try that are really good for you. So that's another option if you're looking for local things. And then the American College of Lifestyle Medicine is who sort of oversees our work as lifestyle medicine docs, and they have some patient-facing things too.
Alrighty, on we go. This is something that I really am happy we were able to incorporate into this, and it's essentially just a reading list. I'm not gonna go and like give a whole 2-page discussion about each of these, but I really liked having this because it helps you all look and learn on your own and explore some of the things that you might like. And these are some of the ones that myself and Lindsay have put together as pretty helpful and engaging kind of resources. I do have like the lifestyle medicine handbook. The ACLM essentially makes like a handbook. It's generally for providers. However, I think it's super useful just to use it as your own toolkit and see how to approach those things yourself. As well, it's very evidence heavy, being in an academic, almost in a way, a textbook academically, but it's very simple read with a lot of nice anecdotes from the perspective of a provider who provides lifestyle medicine. We have a lot of cookbooks here that I think are really interesting books. Dr. Michael Greger is a physician who, in the very early days of lifestyle medicine, and he's put together some pretty comprehensive evidence searches for types of diets and foods that can be used. And the first one is actually disease targeted. So he goes through disease systems and some of the implications that food has for each of those. And then we also have several cookbooks because I think it's really important to like become inspired by some of the things that you read and creating your own kind of diet and things that work best for you. I like to have this just as like a resource if you wanted to do any of your own research. These I think would be a great starting point. And then lastly is a medical checkup book. I noticed this book a couple of years ago and I bought it. And it's really a nice outline for patients that kind of walks the patient through what's in store in terms of office visits with your doctor, what kinds of screenings we do and why. And I think there's a really important emphasis in there on types of like cancer screenings and what kind of tests that would entail and why and when we do those things. So it's not purely a diet-based book, but I do think it is also kind of rewarding and instructive for patients. So I wanted to add this on here as well. This is a slide where we just kind of incorporated a little bit of a literature review, also just in demonstrating how much, these things are being looked into now. And we have a recent one. This was the British Medical Journal on ultra processed food consumption and colorectal cancer risk. I like there's also a big one with the AAFP, which is the American Academy of Family Physicians, that discusses a lot of different types of diets and kind of the goals and recommendations that you can put together for yourself. Goes kind of like food-based through each of these, which is a really nice article. I think the Mediterranean diet is became much more popular, I think, as I went through medical school as a diet, but I think is a very interesting one and is essentially the most, I would say, in line with what like the lifestyle medicine community recommends, in that it's more whole foods, plant-based, or plant heavy. And I think that's a super great place to start as well, and looking for cool recipes. And then there's a couple other here, with the associations with different types of cancer as well. And I think this is all, just in summary and emphasis, that a big point here is that this is an evidence-based modality. I think that there's a lot more that we're going to be able to continue gathering and learning as we, approach medicines as, or food as medicines, and their association to different disease states. I think that's generally the philosophy of why this was all started to begin with, but particularly emphasizing here that there's definitely going to be more to come, which is very exciting. And then lastly, we have a demonstration. So I think one of the best parts about the, structuring of your own lifestyle routine is going through and learning a different recipe, and learning the way to prepare foods that you can enjoy. So Lindsay, I think I'll have you hop back here.
Jen, are you able to pin?
I can't see you anymore.
Yeah.
I think I might just stop the recording. Are you gonna go? Are you gonna stop? Okay, let me